Hello, this is Dr. O. Vasquez from Buffalo, New York. A family physician in private practice, I manage 11,000 patients. Fighting this war in terms of healthcare, having no allegiance to any political group, hospital, managed care markets, telling you the real facts. And I think the more we know about this is we have to have reform across the board. We have to have reform in terms of malpractice so the doctors don't feel that they have to protect themselves against lawyers that look for petty stuff. If someone really gets injured, we should be able to, we shouldn't cut that out either, but have a balance, and there's really no balance now. Two is reform in terms of managed care markets. They're non-for-profits, guys. They don't get audited. So the illegal things that take place in these agencies, and they have lobbyists to support them. We have nothing with regard to that. 20% to manage this, it's outrageous, and they can increase their fees. That's why we see our insurance prices going up and up. But the doctor's offices or the delivery of services, those prices have stayed the same or declined. Patients now don't, I see more and more patients coming in without meds. They can't afford the co-payments. They can't afford the visits. They can't, it's becoming more of an episode, and they're paying for insurance premiums a lot of times. So where the disconnect is, I think we're going to need a private and public plan, not just a public plan. I mean, if we look at the VA system, that's a public plan. And if we can see socialized medicine, it's not working for a lot of those vets. Some may say, okay, I'm a physician. I've seen it do a lot of bad more than good. And so we have systems that don't work right now, and you've got to develop models that do work. I think you develop patient-centered medical care, and we can go back to the way things were. I mean, you see the doctor, you pay a $45 visit with an ATM, and that's it. No billing practices, no denials, and you work from there. I think until that happens, we're not going to get better care. But all these factors have to be looked at by people that do this with no political motive. And I think that's what we're running into more and more of. This is more of an instructional stuff. Now that we have YouTube, we can, you can be honest, and if not, you can check up on me. I'm a family physician in Buffalo. And I just see a lot of these bigger organizations, especially the managed care markets, become developed centers to provide care to patients in urgent care settings, but they are owned by a managed care market, which if you're sick, you don't want to go there. They're going to deny services to you. So, I mean, you've got all that stuff going on, and then you've got these agencies also targeting physicians to make sure that they don't provide the services. And so I just think if you move that piece away, and have direct patient-doctor contact, I think when patients pay for the service, they get more out of it. And doctors having the resources as a result of that can do more for these patients, which right now it's just really bad. And I think people that think they're happy with their present system haven't used it. And the ones that have will tell you. And as a physician providing the services and seeing what obstacles my office runs on a regular basis. I mean, it's $70,000 a year in administrative costs to get per hours for CAT scan, to get per hours for medicine. It's overwhelming. And then you're trying to practice the medicine with the patients and trying to maintain value with volume. And all these things are very difficult. And I think the only winners in this whole process are really the insurance companies for now. They have the best lobbyists, and we don't. I hope this helped. Thank you.